Hi, my name is Mercy Williams. I'm a student practical nurse at Williston State College. And today, for the sake of this video, I am going to be the nurse. I'm going to be conducting a respiratory assessment, a cardiovascular assessment, as well as a peripheral vascular assessment.
My name is Gabriela Berry. I'm a student practical nurse at Williston State College, and for this video, I'm going to be the patient.
My name is Sam Farr. I'm a student nurse at Williston State College, and today I'll be the recorder.
Okay, so I have checked my patient's chart, so I'm familiar with her vital signs. I have done hand hygiene. I've gathered all of my necessary equipment and supplies. So I'm gonna go ahead and knock at my patient's door, provide privacy, and introduce myself. Hi, my name is Mercy Williams. I'm a student practical nurse at Williston State College, and today I will be your nurse. How's it going?
It's doing good. Thank you. How are you?
I'm good, thank you. So today, Gabby, I'm going to be conducting a respiratory assessment, a cardiovascular assessment, as well as a peripheral vascular assessment, and it's going to last for 20 to 30 minutes. Is that okay with you?
Yeah, it's okay.
Okay. So, what's going on? What brings you in today?
I have a headache.
Okay. When did it start?
The headache started like 4 days ago.
Okay. Using one finger, can you point to where?
Yeah, it's around this area around my eye, and it just goes deep into the tissue. It just stays there. It's just around my eye.
Is there anything that makes the pain better or worse?
Just when I hydrate myself or when I have some Tylenol, it make it feel better.
Have you seen any doctors or have you taken any tests before this?
No, I haven't taken any tests, and I haven't visited any doctors until today.
Okay. On a scale from 1 to 10, how would you rate this pain? 1 being no pain and 10 being the worst.
I would say it's around 5.
Okay.
Yeah.
So have you had any do you have any pulmonary diseases such as asthma or COPD?
No, I do not have any pulmonary diseases. I'm pretty much healthy.
How about acute or chronic diseases such as pneumonia or bronchitis?
No, none of those diseases, and no one in my family got those diseases either.
Okay. And do you use any inhaler or bronchial dilator?
No, I do not use any of those devices.
Occupation?
I am a student.
Okay. Do you smoke?
No, I do not smoke. And no one around me smokes either, so I haven't been exposed to secondhand smoke.
Okay. Have you taken the anemo vaccination?
No, I have not been. I'm not sure I know what that is.
Okay. It's a vaccine that it's only in a certain population, like a certain age group. If does that help?
Okay, so it's for certain people who are within certain age.
Yes.
Okay.
Yes. Okay. So I'm just going to go ahead and ask you, do you cough any mucus, any hard coughing?
No mucus, no coughing.
Okay, so I'm just gonna hop right into the assessment, and I'm gonna start by inspecting the thorax. And the purpose of inspecting the thorax, I'm looking for any shape, size, symmetry, color, respiratory rate, or rhythm. Okay, so I'm looking at the anterior side of Gabriella's chest, and I am inspecting, like I said, for any size, shape, respiratory rhyme or rhythm. I see that the respiratory rate is in normal rhythm, even and smooth rhythm. I see the respiration is even and smooth. The rhythm is regular. And the transverse diameter is approximately twice the AP diameter. And I see that the AP to transverse ratio is 1 to 2. The coastal angle is less than 90. Okay. And I see that her sternum is symmetrical, and her clavicle and scapula is the same height. I see that her chest movement is symmetrical, and I'm looking at her skin color, and it looks uniform and intact. So I'm gonna go ahead and look at the posterior angle. So, I'll have you take your sweater off so I have a better view. So I'm looking at the size, the shape, the color, the respiratory rate and rhythm. And I see that the respiratory rate and rhythm is normal. I don't see any abnormalities. And I see that she's sitting up straight as opposed to leaning over and trying to breathe or trying to catch her breath forcefully. So I'm gonna look at the lateral angle. And again, everything does look within normal limits. I don't see any abnormal respiration. I don't see any abnormal skin colors, any lesions or bumps. I don't see any burial chest. So everything is within normal limits. So I'm gonna go ahead and move on to palpating the thorax. Excuse me, Gabriella. So the purpose of this is to assess the characteristic of the thorax cage, okay? All right. So I'm inspecting for any moisture, temperature, and colors. So I'm gonna start feeling your chest. So the skin is dry, surface is smooth and uniform, no tenderness. I don't see any irregular surfaces, no bumps, no messes, and I'll just have you move to the bed so it's easier to conduct. It is not tender to touch. Is it tender to touch, Gabriella?
No.
Okay. I'm gonna palpate your back again. So the skin is dry, the surface is dry, no warmness, no tenderness. I'm gonna go ahead and do the sides. I don't feel any abnormal findings. And everything looks within normal limits. I don't see any abnormal respiration. I don't see any abnormal skin colors. So I'm going to go ahead and palpate for symmetrical expansion. And the purpose of that is to express expansion of the thoracic cage. So again, Gabrielle will be touching you. And then I'm gonna go ahead and ask you to take a deep breath through the nose and exhale through the mouth. Again. Okay. I'll do the back. Okay, again. So I see that my thumbs is moving symmetrically with inspiration and it's returning to the original with expiration. Again, my thumb is moving apart symmetrically with inspiration and it's returning back to the original back with expiration. And there is no abnormalities. Okay? So I'm going to go ahead and palpate the tactile phrenatus. The purpose is to palpate voice sounds or vibration through the bronchi. Okay? So I'm going to have you take a deep breath, and I'm going to have you say 99.
99. 99.
Okay. And I'm going to the posterior area. I'm going to have you say 99.
99.
99.
99. 99. 99. 99.
So palpable vibration
99.
of sounds are felt equally on both sides of the lung.
99. 99. 99.
Okay, so the palpable vibration with sound on both sides of the lungs. So So I don't see any abnormalities. And I didn't, hear any abnormalities. There's no increase for metis, and there's no decrease for metis. So I'm gonna go ahead. Gabriella, how are you doing so far?
I'm doing okay. I can breathe well, and hopefully the doctor can give me something for that heating that's driving me crazy. How is your day?
It's good. Thank you for asking.
Lots of patients in the hospital?
Yep. So I'm gonna go ahead and move on to percussing the, thorax.
Okay.
And this is to assess the presence of air in each line. Okay? So I'm gonna put my hands between your clavicle and I'm gonna tap. I'm gonna do this area. And tap in. And tap under. And just have you move your hands over and go. Okay? I'm gonna have the back. I'm gonna pull the other way. Okay. Do it again. So the sound is clear, it's hollow, and it is percussed. Sounds like it's over healthy air lungs. There's no hyperness, no hyper reasonings, so I know that this is normal findings. Okay, and the pitch is really low, it's clear, and it's hollow, and it is also percussed. So I know that her lungs is healthy. So I'm going to move on to auscultating. Okay, and I know that the purpose of auscultating is to assess the airflows to the lungs. So I'm going to go ahead and take my stethoscope and listen through all of the area. I just have to take deep breaths. Take deep breaths. Inhale, exhale. There you go. I'll do the same on the back. Okay. So I know that this is normal findings. The breath sound was heard over the trachea, and I know that it's, like I said, it's heard over the trachea and larger bronchi. So I know that this is normal findings. Okay, I'll go ahead and document. Okay, how are you doing so far?
I'm doing okay. And
Okay.
it's not taking that long.
That's awesome. So far, everything is within normal findings, which is good. So now I'm going to go ahead and conduct an assessment of the cardiovascular and peripheral vascular. So I'm going to start by inspecting her anterior chest. I'm just looking at her anterior chest. Okay, for the purpose, I cannot have her lay down, so sitting up is what we're going to be doing. So I'm inspecting. I don't see any lift. I don't see any forceful breathing. I see the chest is symmetrical, no heaves, no lifts, okay? And they're all within normal findings. So I'm gonna go ahead and move on to palpating the pericardium and the apical pulse. Okay, so I'm gonna place my hands in the apical pulse. Let's see on her. Okay. And it sounds synchronized, so I'm gonna go ahead again and assess. Palpate, excuse me. Okay, I don't see any pulsation, there's none found in the 5 landmarks. And apical pulse was palpated and, at the 5th left space, at the 5th intercostal space, excuse me. Okay, so now I'm gonna go ahead and move to, excuse me. I'm gonna go ahead and auscultate the sounds. I'm gonna go ahead and auscultate the heart sounds. And this is to, assess the heart sounds and rhythm, rate and rhythm. Typically, my patient would be laying flat, but for the sake of this video, she's sitting up. Okay. Okay, I'm gonna go ahead and assess that. Just have you move your hair over. Okay, I'm gonna listen to. So I know that the S1 and S2 sound is heard. There is regular pattern. The split S2 sound is normal, and it is affected by respiration. So I don't hear any extra or abnormal heart sounds heard. So we are complete with this assessment. I appreciate your patience. I'll go ahead and let the doctors know. Do you have any questions for me so far?
No, I do not have any questions.
Okay.
Thank you.
You're welcome. I'll go ahead and let your doctor know, okay?
Thank you.
Have a good day.
Likewise.